New technology in Amarillo aims to help women detect breast cancer earlier. News Channel 10's Sarah Macias joins us now live in the studio with how 3D mammograms can save lives.
Doctors say this 3D technology will detect breast cancer 41% earlier than traditional 2D mammograms. This means fewer callbacks for patients, especially for women with dense breast tissue or cystic breast, who are often called back for additional screening. The 3D mammograms allow more images to be taken, giving the clinical breast radiologist a better view through the entire breast.
The early stages, it's curable, and the 5-year survival rate of a stage 1 breast cancer is nearly at 100%, versus as you increase the stage of diagnosis, that survival rate drops significantly.
Texas Oncology says the new technology is safe with low radiation exposure. A 3D mammogram takes about the same amount of time as a 2D one. Once women turn 40, doctors recommend annual mammograms because they are more at risk of developing breast cancer. Reporting live in the studio, Sarah Macias, News Channel 10.
And there could be an improvement for the treatment of other certain forms of cancer. Researchers say that having a patient inhale supplemental oxygen can weaken immunotherapy and shrink tumors. The reason for the shrinking of tumors, according to experts, is that the oxygen wakes up anti-tumor cells. They say these findings could dramatically increase the survival rate of patients with cancer.
Well, area women now have another option to fight breast cancer. News Channel 10's Sarah Macias joins us live in the studio with the newest technology in Amarillo and how it can save lives.
For the first time in the Panhandle, women can get their mammograms in 3D. Doctors say this can detect tumors and cancer cells easier and earlier. A local woman we spoke with says early detection saved her life.
People saying, well, this will never happen to me, you know. And a year before I was detected, my mother had cancer, breast cancer. And so I was a little familiar with the process.
Lucille is a breast cancer survivor, and although she has not had 3D mammograms done, she says it's important for doctors to continue to find ways to detect breast cancer at its earliest stages. Sometimes
those little tumors hide, and it takes more than one time to find it, so I think 3D is a very good thing.
The 3D mammography works in the same ways as 2D. Oncologists say it's safe with low radiation exposure.
The difference is that there is the X-ray tube swings in an arc around the breast, and those images are reconstructed. There's still compression involved, but all it adds is a very minimal amount of time, an extra 4 seconds per image, and most patients who get this done have told us that they don't even notice the difference.
Seconds after a patient is done receiving a screening 3D mammogram, the images come to a reading room where a clinical breast radiologist interprets them, and the results are available within a few days. To the left of the screen is a 2D image, and to the right is a 3D one. Doctors say the 3D image has a better view of the entire breast.
Instead of just 4 images, we're looking at 1 millimeter slices through the breast on all the projections that are taken, and usually for a mammogram, that's 2 projections in each breast.
For patients, this means fewer callbacks, especially for women with dense breast tissue or cystic breast, who are often called back for additional screening. Doctors recommend women over the age of 40 to get annual mammograms because they are more at risk of developing breast cancer. Reporting live in the studio, Sarah Macias, News Channel 10.
3D mammograms are now available in Amarillo to help women detect breast cancer. Doctors say this 3D technology will identify tumors and cancer cells earlier. Although the 3D mammography works in the same ways as 2D, more images are taken and doctors have a better view of the entire breast.
Instead of just 4 images, we're looking at 1 millimeter slices through the breast on all the projections that are taken, and usually for a mammogram, that's 2 projections in each breast.
This means fewer callbacks for patients, especially for women with dense breast tissue or cystic breasts, who are often called back for additional screening.
Well, you can look for temperatures to warm up.